Welcome to our Eat and Meet career session. I'm Andre Luck, PVCC's Career Services Manager, and today we're going to be talking about health sciences careers. And our guests are Susan Kabadi, to my immediate right, and Susan is a diagnostic medical sonographer, and she works at the University of Virginia Health System. She is an ultrasound technologist at UVA, and she has an undergraduate degree from the University of Virginia, which she received in 2014. She also went to PVCC afterwards and received her Associate of Science in Diagnostic Medical Sonography in 2017. She is a graduate student at the George Washington University. And then next to Susan is Sarah Sotherden. Sarah is a professional billing and coding manager, and she is at Sentara Healthcare, and she has been working in the healthcare industry for over 12 years. She has been a certified professional coder for 8 years, and she is a certified professional medical auditor, which she's been for 4 years. She has medical coding oversight for various surgical specialties, including orthopedics, neurosurgery, vascular, and general surgery. She is currently working towards her master's degree in healthcare administration at Mary Baldwin University and has over 40 medical coders working in a remote capacity. And then we have Camilla Washington, who is a clinical education team coordinator for Sentara Martha Jefferson Medical Group. Camilla has been in the healthcare industry for 26 years. She earned her undergraduate nursing degree from James Madison University, and with the past 9 years being spent with Sentara Martha Jefferson Medical Group as the clinical education team coordinator. She is responsible for healthcare compliance, policy and procedure review, process improvement, and guiding clinical quality initiatives. She will graduate in November from Walden University with a Master of Science degree in nursing with a focus on nurse education leadership. Thank you for being here, all of you. We're really excited to hear what you have to say about your professions and the industry in general. I'm going to start with Susan, and I'd like for each of you to answer the same question. If you can define what your position is, just to give us a better understanding.
All right, so I am a diagnostic medical sonographer. Another name for that is an ultrasound technologist. And basically, I just perform ultrasounds. And it actually encompasses, at least at UVA, a wide variety of exams. So I perform exams on the abdomen, also obstetrics and gynecology, vascular exams, and pediatric exams. We have a neonatal intensive care unit at UVA, as well as a pediatric intensive care unit. So we scan patients from all of those areas, and our exams get interpreted, and the patient ultimately gets diagnosed by a radiologist, and they are the ones who ultimately determine what the findings are on the ultrasounds that me and my coworkers perform.
Hi, everyone. As the professional coding and billing manager at Sentara Healthcare, I am responsible for the oversight of the physician coders for the various specialties that Andre had discussed. I work with the physicians in those to ensure that they know how to document and they enter things correctly in the system. I do a lot more than just the oversight of the team of coders. There's a lot more process improvement, troubleshooting, system interfaces that I'm involved in now. And as you know, healthcare is a lot more IT oriented than it used to be. So it's a lot of computer troubleshooting, but I work with the team, help them develop and grow, get their education, and make sure that the revenue gets in each month.
Hi, so with a clinical education team coordinator at Sentara, I am responsible for 13 primary care locations across this area and 7 specialty clinics where I'm responsible for coordinating and developing education for our clinical support staff that are in those practices. So that includes registered nurses, LPNs, as well as medical assistants. I am responsible, just like Andre mentioned, for compliance. So I will go out into the various clinics and actually perform compliance rounds where I'm looking for items that may not be in compliance with either OSHA or with any of our other regulatory agencies that we comply with. I'm also responsible for performance improvement, so going out and looking at the different efficiencies within those practices, looking at workflows, making sure that we are as efficient as possible, as well as providing the effective health care that we're responsible for providing.
So Sarah, I'll start with you. How did you get started in your profession?
Well, it's interesting. So most of us, I don't know, I guess some people do go to school and say, this is what I want to be. I want to be a nurse. They go to school to be a nurse, and they end up a nurse. So I started out as on the clinical side, and I wanted to be a nurse. And I was working in a nursing home, and I was the youngest without children, so I was pulling doubles every weekend, and I had no life, and I thought, this is not the life I want. So I ended up getting a job at UVA when they opened the Access Hub at their medical office building, and I fell in love with the wonderful world of insurance. So here we are many years later, still loving insurance.
Very good. Camilla.
So I started my profession actually at UVA Children's Hospital. While I was in nursing school, I actually worked there on the weekends, really trying to get my foot in the door. Back in the early 90s, there was a huge influx of nursing, and so nursing jobs were very difficult to get into. There was a lot of competition in getting into nursing positions. So I saw this as really a great gateway for me to gain knowledge, use my nursing skills that I was obtaining while I was in nursing school, and hopefully obtain a job. So I was there in the Children's Hospital for about 6 years, and then my husband's job actually moved us to the Tidewater area, where I had the opportunity to get into a lot of different types of nursing. So I had the opportunity to do some public health nursing, school nursing, home health nursing, and then when his career moved us back to this area, which is home for us, then I moved into working as a pediatric nurse in a private pediatrician's office, and then the opportunity to move to Sentara came upon back in about 9 years ago.
And Susan, I know you started, you got a bachelor's degree first, and then you came here. So tell us your story.
So my path to ultrasound was also not completely straightforward. I realized when I was in undergrad that I wanted to be in healthcare. I wanted a job that was rewarding and would allow me to help others. So after I graduated, I decided to shadow a variety of different professionals in healthcare, and I was really drawn to ultrasound because it has the technology component to it and also the patient interaction, which was really important to me. So that's ultimately what kind of led me to that career path, and I did graduate from here, so it turned out really well.
And if you walk down our hall, past the Bolick Student Center, you'll see our alumni wall of fame, and Susan is the first one you'll see. Okay, just had to put in a plug. What type of education is needed for your profession? And Camilla, we'll start with you.
So to become a team coordinator at Sentara, in my role, you must have a Bachelor's of Science in Nursing. And really looking for management experience or clinical experience with at least 3 to 4 years of the healthcare profession in which you're desiring to become a member of.
Okay. Susan.
So to become a diagnostic medical sonographer, you do need to have an Associate's of Science in Diagnostic Medical Sonography, and you also need to pass a board registry exam that certifies that you are a registered diagnostic medical sonographer, but that certification is actually part of the program here at Piedmont. So if you enroll in the program and complete it, you will be able to take that certifying exam.
Did I cut it on? Yeah. So to become a professional coder, you have to become certified through the American Academy of Professional Coders or through AHIMA, which is another credentialing body. You need experience working in healthcare, understanding anatomy and physiology because you're reading off notes all day long. And then to move into a management level, you just have to have experience or advanced degrees.
Can each of you take us through a typical day or a typical week, like a day in the life of, just so we can have an understanding of what goes on? And I'm sure every day is different. Anyone can start.
I'll go ahead and start since I didn't cut my microphone off. So that's kind of a interesting question. Every day is different in my career, especially as a manager. For my team, their days are pretty consistent. Most of them wake up and they go turn their computers on. So they don't get dressed or anything like that, make their coffee. They work remotely, which is enjoyable. But typically for the coders, it's pretty routine with what they're doing. They're reading medical records and then they're assigning codes. They are inquiring from physicians or other healthcare providers about notes that may not be finished or complete in order to do that. Other than that, that's pretty straightforward for them. Myself, it's kind of doing a lot of troubleshooting and being very reactive in a lot of things. I like to try and be more proactive, but tends to be putting fires out in my role.
Typical day for me. Our medical group actually participates within the hospital's safety huddles each morning. So if I'm assigned to safety huddle that week, my day starts off at 8 a.m. Going to the hospital where there's collaboration among all the different departments, looking at census, looking at any medication errors that may have occurred or any patient safety errors that may have occurred within the past 24 hours, looking forward 24 hours to see if there are any issues that should be addressed or of concern for that 24 hours, as well as just sharing any information that you may have about what's going on within your department. A typical day for me in the office may mean going down the hall and talking to Sarah. We do spend some time together actually looking at charts, looking at how providers are coding charts, how clinical staff are actually documenting in a health record. Just as Sarah said earlier, healthcare has become very technology focused. And so we know that with technology and healthcare, the way that we train our clinical staff to document is very important. Oftentimes that documentation is pulled back into reports so that we can either justify positions that we say that are needed or for us to actually report those codes off to different billing agencies. I actually do a lot of troubleshooting as well. There are times where I will get calls from practices and they're asking me to review a chart, to look at the documentation, to look at gaps that may be seen in the medical record, or I may be out in the practice actually shadowing or just observing workflows so that I can get a better understanding of what's going on in a daily operation so that I can come back and report to upper level management on what's going on in the practice and where I may see that there may be needs for us to expand our services.
So when I get to work in the morning, I am stationed in the main hospital at UVA, and we see primarily inpatients and patients who are coming through the emergency room. So when I come in, there's usually already a list of patients and orders that we have, and we work through those based on primarily their urgency. So patients who come through the emergency room are going to be a higher priority. We'll try to take care of those as soon as we can. Other exams are a bit more routine, so we'll get to those when we have time. So my job is constantly a juggling act, trying to manage many people's requests and competing priorities. But we always try to make sure that we get the right exam done in a timely manner so that the radiologist can make a report and the patient can have their diagnosis and a course of treatment can be made.
So what type of careers or career ladders are there in your professions?
I'll go. So as a diagnostic medical sonographer, there's different types of specialties that you can go into. I mentioned that you have to have a registry earlier, but within that, there's different specialties that you can become certified in. So those include abdomen, obstetrics and gynecology, vascular, pediatrics, musculoskeletal. So you can go into all of those different branches of ultrasound, and eventually over time you can even take on more responsibilities and become a chief technologist.
Typically, people start out in medical billing or in access, like I did, and you're getting an introduction to insurance, you're getting an introduction to anatomy and physiology and how healthcare works. And so medical billing is a great place to start for people who might be interested in coding. From there, people end up getting their certification and moving into a coding role. There are several specialties that you can become. You can become specialized in a certain coding division that you like, or you can go down medical auditing. Medical compliance is another one that people go into. Practice management is another one that is big. From there, you can go into management, whether it's middle management, and you can work your way on up to senior management. There's a lot of opportunities within coding that branch out from there, whether it's doing diagnosis coding, hospital coding, professional coding. So it's pretty endless what you can do with coding.
As far as clinical ladder within the positions that I oversee, I think the best place to start would be in an ambulatory care setting, working out in the field, getting some knowledge and some understanding of the day in and day out of the daily operations of becoming a nurse. Then the next logical move would be what we call a staff development educator. And so that person is responsible for side-by-side training with new clinical hires, whether it's a registered nurse, an LPN, or with a medical assistant. And then typically from that position, that person becomes board certified, where they actually have to take another exam to become board certified and designate that they are specialized in that type of education. Then from that position, it's moving into the position that I'm in, where you actually oversee and coordinate all that clinical training and have access to all of those other different practices that are out in our medical group. From that position, the next step would be becoming a clinical operations director, and then you are really kind of at that 10,000-foot level of kind of overseeing those that are coordinating education, as well as those that are providing that one-on-one education, or those that are performing clinical duties within the practice.
I know that many of you had to do clinicals in order to complete your studies, but I'm curious, do you offer internships in case anyone out here might be seeking an internship down the road?
So in the program at PVCC, we do, as you mentioned, have clinical rotations that are required by all students. So you will rotate through a variety of different settings, including outpatient centers, small hospitals, large hospitals, maybe special medical offices. So you get exposed to a lot of different environments, which is really helpful for when you enter the working world. But in terms of internships, We don't have those, but we always allow students or people who are interested in joining the ultrasound community an opportunity to shadow us so that you can really see exactly what it is that we do, what our workflow is like, and if it's something that you would be interested in.
The HIM program here does require that you do an internship. We have been working with that program since before I started at Martha Jefferson in 2013, and I've been bringing interns on site pretty much every year, sometimes twice a year. It's very hard to get into coding without education, so it's a great opportunity to start getting that education with the internship.
Within our medical group, we do have a wonderful relationship with Piedmont in being able to provide internships for medical assisting students, LPNs, as well as RNs.
So do you have any job openings, and if not, what type of positions do you currently recruit for? I'm sure you have job openings, but...
Yes, within our ambulatory care setting, yes, we do have quite a few job openings for medical assistants, LPNs, as well as RNs. For our medical assistant positions, you are not required to be certified to come and join our healthcare system. Again, we have a great relationship with PVCC and being able to offer that certification program to staff who are not certified at an entry level. But yes, we do have several positions available.
So we currently don't have any open positions within the coding department right now. Gosh, I haven't had turnover in a really long time. People get really comfortable in their remote coding positions. But I would recommend starting out in the ambulatory division. You're getting that healthcare experience, knowing how the front office runs, knowing why issues happen, knowing how to troubleshoot those things, learning the EMR. So starting out in medical assisting is a great opportunity if that is something that you are interested in long term. But our positions kind of change, our needs change based on kind of the healthcare needs. So when we bring on new departments, neurointerventional radiology is one that we're really growing right now, and that's a highly specialized focus as far as coding. And so again, we might have to pull some of our more senior coders to support that growth, and then we would have more openings for some of the more straightforward things like primary care.
Currently, we have, I believe, one full-time opening, and we almost always have standing PRN positions open. We can always use extra hands, so that's our current status right now.
Okay. And if someone wanted to apply for a position, what would they do? How would they go through that process?
So at UVA, the best place to start to apply for a job is just to go to the Human Resources website, I believe, and you can just search sonography or ultrasound, and all of the open positions will come up, and the application will be right on there, and I think you just have to create a profile and fill out some information, and then UVA will be in contact with you.
For both Camilla and I, it's kind of the same situation. You're going to go to sentaracareers.com. You can search on there for certain keywords. You can search by location. You can search by job category. As far as coding, there's a lot of positions that are not specific to a market. It might say Charlottesville, but it could be anywhere in Virginia, depending on what the career was that you were looking for. One of the things that I will note with applying through Sentara, we have a fairly rigorous application process, and there are personality tests, I don't know, but they screen. It takes about 30 minutes to kind of get through, but you know, if you are interested in that position, you make sure that you take the time to set aside to focus on that application and answering those questions.
What qualities make for the best employees? I'm sure you've seen all types.
Absolutely. I think one of the best qualities that you can bring to a healthcare position is a willingness to learn, to be engaging, and to want to have the ability to help people. Healthcare is very people intense. And so you have to really have the right personality to be in front of people all the time. Oftentimes what I tell staff is, we all have problems, but you have to be able to leave them at the door. You really cannot come into a healthcare facility and want to help someone and to be a team player and to help your coworkers when you're bringing all of your baggage through the door as well. But really wanting to learn, being willing to learn, being flexible, having the ability to really think outside the box and try new things. Healthcare is constantly changing, and I think you just have to have an open mind and try new things.
I would imagine if you bring your baggage to work, the patient can pick up on it and it can really affect their sense of security.
Absolutely. I think we see that most often with our patient experience scores. If we really go back and look at our patient experience trends and our responses, we can definitely tell where there may have been some really challenging times with either staffing or if there was turnover on a particular unit. You definitely can tell in those patient experience scores. We're very engaged with rounding in the hospital every hour, making sure that our clinical staff are going in and checking on patients, whether they need to perform a clinical intervention or not, just to let the patient know that they're available to them. In the ambulatory care setting, again, I always tell clinical staff, treat that patient as if you were taking care of your mother. Because if you have that mindset, then you're going to have that face-to-face conversation. You're going to call them by name and really listen to them. And I think listening is a huge aspect of clinical.
In addition to what Camilla said, adaptability is a big one in my field. Things are changing constantly, with the influx of patients or the changes in trends in healthcare, our focus can shift pretty quickly. So having people that can adapt well is a huge help. And my other big thing as far as a medical coder is I need independent thinkers. I need people that, are self-starters, that don't need a whole lot of oversight as they're working remotely, that can make a decision and act on it. My biggest thing is, make a mistake, you learn from them. So people that are comfortable in doing those things and working without a whole lot of supervision.
I would definitely echo all of those qualities. I guess tying all of that together, kind of what I would say makes a good employee is someone who tries to keep the patient at the focus of everything that they do. Ultimately, whether you're a physician or a nurse or an ultrasound technologist, we're all in this field because we want to help the patients. Sometimes our jobs can be really challenging for a variety of reasons, but as long as you keep the patient at the center, you'll always make the right decision. And I think you guys covered it all pretty well, but I would also just add employees who are motivated to do their best. We, like you were saying, with kind of leaving baggage at the door, you constantly have to motivate yourself to do your best and always keep the patient at the forefront. So otherwise, I totally agree with what you said.
So what might disqualify someone from being employed?
The biggest thing at Sentara is that we're a tobacco-free organization. So no smoking, no chewing tobacco or anything like that. That is, we've been doing that for many years now. So that's the biggest thing at Sentara, especially in my career. We're not clinical, so being tobacco-free is a big thing. We promote health, so we want our employees to be healthy as well.
So are you saying that there is no place on the campus for tobacco products, right?
So no, the campus is also tobacco-free, but we will not hire anybody that is using tobacco. So you have to do a tobacco screening
Okay,
as part of the employment conditions.
okay. Do you do drug screenings or any other type of
Yes,
screenings?
absolutely, yep.
Okay. You have any comments, Susan?
I think any type of illegal drug use is the major thing that would disqualify you at UVA.
Okay. What about barrier crimes? Criminal histories?
So particularly in nursing, barrier crimes are kind of eliminate you from many positions. If you've ever been involved in a barrier crime, criminal history is a significant piece to becoming a healthcare provider. There are several people out in the community that I've had several conversations with, and once you start talking to them, and if there is a barrier crime, that kind of eliminates them. So, one of the things that when I talk to students or, I'm out in the community, I always tell people, your track record follows you. You have to be very mindful of what you're doing at a young age because it really can stifle your professional career later on.
You may not know the answer to this question, but it seems to be it's trending right now across the country, the medicinal use of marijuana. And so being a healthcare, you all work in a healthcare facility, so where do we stand with UVA, Martha Jefferson, as far as employees being able to come to work if they're using a drug for medicinal purposes, not recreational?
So as an ultrasound technologist, I actually have not come across that particular situation before, so I might not be the best person to answer that question, but if that is something anyone wanted to know the answer to, they can always reach out to UVA.
Okay.
Human resources would be the best contact for anyone with those types of questions.
Okay, good. We're going to take some questions from our audience right now.
I knew we had one, but we hope we have other questions too.
So, Andre, unfortunately, you took my first question, so I had to come up with the second one.
Okay.
But so, Camilla, you mentioned about a medical assistant. What exactly would be the process here at Piedmont, if you know it, to go into that role with Sentara or with Martha Jefferson, I believe, also?
So like I mentioned, for our medical assisting positions, you really don't have to have any prior experience. It is helpful. A lot of our medical assistants come to us as certified nursing assistants. So they typically have some hospital background, or oftentimes they'll come to us as nursing students, looking for some hours to help support them while they're in school. So a lot of it is on-the-job training. A lot of it is task-oriented, learning how to take vital signs, how to recognize medications, and to be able to go through a patient's list of medications and do what we call reconciliation, making sure that they are taking their medications the way that the provider has prescribed for them to take their medications, talking to them about any health concerns or issues, and then learning how to navigate in the electronic health record.
So to piggyback on that, we have Joanna Collins from our Workforce Services Division who coordinates with Sentara.
Hi, you guys. Thanks for coming. I just want to follow up on that because it's a perfect introduction to what we offer. We have two pathways for the medical assisting process. One focuses with CNA because it's a highly needed patient care area and you're very diverse in the job opportunities that you have. So CNA is a great training. From there, we have created a ladder pathway that allows you to certify in CNA first, and then medication aid, phlebotomy, and EKG. So you're individually certified in those particular areas of study. Once you've completed those, then you can enroll in what we call the CCMA Advanced, which is an online module with an externship in a clinical office, and then sit for the CCMA exam. We have a student who is here right now who has completed that pathway. Hi, Kathy. And we have another student who is finishing up that pathway right now. Hi, Ashley. And I think we're excited to say that the results of the exam for the CCMA Advanced track is actually highly significant. Their scores are much higher than those who took the regular CCMA class. So the typical CCMA class is about 6 months long by the time they finish their externship. We currently partner with Sentara to train their employees, so their incumbent workers who are interested in the CCMA class. So we schedule classes around their work schedule. So that's kind of the things that we do. So we have a great CNA program, but we also have lots of things that come after CNA. So just keep thinking there's a pathway to that can lead into nursing. One other thing I'd like to mention, we had some UVA students come in and ask about hours for PA. So to get into PA school, you have to have 1,500 hours of patient care experience. They have to be in a job where they can get that. CNA and medical assisting are two areas where they can meet that requirement. So it's a short-term training to get them into the working role to get their requirements to enter PA school. So if you're interested in that pathway, that's another one that is highly rising, lots of opportunities. Thank you.
Did you have another question, Alex? So are there other questions that other people have? Okay. I'm going to get my workout today.
First, thank you all for your comments and your time. It's helpful. Question for Sarah. You mentioned certification needed for coding. Is that something that needs to come before employment, or do you hire the right person, get them started, and then get them into the certification process? Can you speak a little bit about that?
I can. Great question. So typically the coding positions do require a certified coder. Now, I know I've got a thing for new coders. I love giving people the experience because it's such a hard career to get into, and you got to start somewhere. And like I said earlier, healthcare is a lot about IT. And so I find some of the newer coders, they're more change-oriented, forward thinkers than some of the coders that might have 20 years experience. So sometimes I will absolutely take a gamble on someone who isn't certified and help them get through that program and get them certified. Learning the material means a lot more when they're doing it than just reading the book. So just depends on the needs, but absolutely we will do that.
I have a follow-up question on that because I've got to participate in the May Mania. Can you talk about that kind of what the organization does or that it sponsors that event?
Absolutely. So as a medical coder, you've got to be a part of the professional affiliation, the American Academy of Professional Coders. There are hundreds of local chapters that you are assigned to. And these local chapters offer you the opportunity to do CEUs, continuing education units, which you need, just like you do for nursing and as a physician. We do local chapter meetings pretty much every month. We also do annual seminars, May Mania being one of those, and our annual December one. And it's an opportunity for people who need the continuing education credits, but it's also an opportunity for the local community to get involved and see with what we're doing if you're interested in that. I do have cards with me today if you're interested in visiting one of our monthly meetings. We typically have physicians or other healthcare professionals speak at these meetings to talk more about things that they are doing to help you learn how to code those things.
Okay, any other? Yay.
Hi, we have a group of very, very motivated young high school students here that are in the CNA program up in Greene County. First of all, I'd like to, if you would address age requirements, because they'll get their CNA even before they graduate from high school. So as far as the avenues that they can take.
Congratulations. That's awesome. It makes my heart very warm to know that high schools are really investing in our young adults to really help them find a career path and to be successful and to walk away with a certification at high school graduation is amazing. So congratulations to you on that. Again, I think that that willingness to learn is essential. For you to have your CNA and to be able to apply for a position within a healthcare facility is enormous. And once you graduate and you are 18 and you can come and work for us, and I have cards with me, I'd be willing to speak to any one of you that might be interested in just trying to figure out, your next move and how we can help you continue to grow in the profession.
Any other questions? Or are you just looking at the pizza? Or smelling the pizza?
What is the growth outlook for all of these?
So that was a great question. That is one that, I discuss a lot with my team because, we work really hard to get the physicians to code accurately. But then there's also this initiative from the federal government that it's patients over paperwork. So there's, a lot of things to balance right there. As I was saying earlier, there's a lot of paths that you can go down. So if we can automate some of the things that they manually do right now, it does eliminate some of the need that they do, but it does allow them to do things that are need. So we're moving more towards quality-focused care instead of fee-for-service care. We are reporting things based on diagnosis. So physicians are being paid to manage sicker populations. So coders are used to pull and abstract those diagnoses for the sicker patients to those records so that we can be paid for a quality basis.
I don't know the exact statistic for ultrasound growth, but I can tell you it's growing. There is a huge need for ultrasound technologists right now. Really, the whole technology of ultrasound is just really growing, and providers are using it more as portable ultrasound devices are being made, and there's more capabilities being developed with it. So there's currently, if you even do like a job search right now, you'll find a lot of job openings for ultrasound technologists, and PVCC is a really great program because almost all of the graduates, I think all of them have actually gotten jobs within the last 3 years of the classes. So that would definitely be a very stable job field to go into. And I also just wanted to add regarding the age requirement for CNAs. At UVA, I'm almost positive the age is 18. And I also wanted to mention that the ultrasound department actually just hired a CNA to assist with ultrasound guided procedures. This one individual got her CNA, and she is interested in doing ultrasound in the future. So she's working on her prerequisites, and she's also gaining experience with ultrasound because she's actually assisting with all of those. So if that's something you're interested in, you can always look out for opportunities like that.
And I will tell you that each of our panelists represents one of the programs of study that we have at PVCC. Nursing, diagnostic medical sonography, as well as health information management. And PVCC will not develop a program unless they've already done the market research in our local community to see if there is a demand for those services. So as far as these panelists and their professions, there is a demand in our local PVCC service region.
Growth opportunities in nursing are endless. When I started in this profession 26 years ago, if somebody would have told me that I would have been in a position like this, I would have never thought that that was possible, let alone know what the position really entailed. Just as Sarah said, the quality over quantity within healthcare is expanding so much faster than we can keep or put nurses into positions. A lot of chronic care management, a lot of just being able to work independently and provide support to a group of a patient population that are in need of sometimes just how do I get to a doctor's appointment, how to navigate the healthcare system. As healthcare becomes more complex, we know that our nurses spend a lot of time being there just to support and help patients navigate the system, help them understand what their providers are telling them, how can they actually take care of themselves when they get back home, because their home may not look like my home. They don't have the support system available to them. And a lot of times our patients are embarrassed to talk about what they have or what they don't have. So being able to interview our patients and really learn more about them and being able to provide the services to them is critical.
Sorry, I'm back. Just had a thought. I was curious if each of the three of you would mind saying a little bit about how your field has changed, in your experience of the field has changed since healthcare reform took effect. And sorry, Susan, I may have, not sure if I covered you on that one. But if you have something to say that you know from talking to other sonographers, please say so.
I'm actually going to defer to these two ladies, also partly because I'm pretty new, actually. I've been in the field for about 2.5 years, so I'm going to let them do it.
I think I cut my mic on too soon. So yes, again, great question, and our field has changed pretty significantly with health reform, and I am looking forward to that changing much more in the future. And I'm very passionate about being a part of that change because our healthcare system is very broken right now. There's a lot of need to fix it, and not one of us has an answer, but collectively we do. And so why we work so closely together, and that's one of the things that I think we've seen kind of evolve is we work together on how to make some of these programs work. As she mentioned, chronic care management and other more services like patient-centered medical homes and screenings and preventative medicine have become things that providers can actually get paid for. So services that they're doing managing the patient and some of the barriers that they have at home are things that they can get paid for. They're spending their time doing these things. So I, help Camilla and support the clinical team on building documentation, templates, and what that system interface looks like so that we can actually recoup some money on that and continue providing these types of services that actually benefit patients.
I think one of the biggest changes that I've seen in nursing is oftentimes nurses feel like they're just clicking a box. Their documentation system has become very standardized, and Sarah and I talk about this quite a bit, and being able to look at a provider note and being able to identify that individualized attention that providers are putting into the notes, because so much of it is structured and reportable, and did we click the box, and how are we coding this patient, and are we really documenting this patient as sick as they are, that we believe them to be, because we need the dollars to help take care of these patients. But just like Sarah said, I think that this is a great time and a great opportunity for us to become more engaged and to be that voice for our patients, for those who may not understand the system completely. It's our job to help them understand, and that takes time.
So I have a quick little question. Oh, actually, anybody else out here? Because we are getting 10 till. Oh, yep.
With the clinicals and internships, how long does it take to complete the programs here that you all are dealing with?
The ultrasound program at Piedmont takes 2 years to do, and basically you do clinical rotations for all of the semesters except your very first semester. So they'll kind of wean you into it gradually. Your second semester of the program, you'll just do 1 day a week rotation, and it's mostly just observing, just kind of seeing what the workflow is like. And then as you get into your third and fourth semesters, it's going to be either 3 and then eventually 4 days a week. And that's really kind of the meat of the whole program, is those rotations. So it's there for the vast majority of the program.
And Gigi, I can't remember exactly what the hours was. Was it 40 or 80?
Actually, it's down to 32, I
32?
think. So we revamped our HIM program about a year or so ago to make it a bit more manageable, because it really, it was getting the certification, and so now it's down to about 32. You do an internship in your last semester. So 32 doesn't always necessarily mean 1 year for some people, especially if they're working full-time hours, and it's hard for them to commit to going to school full-time. And so our HIM program is on the relatively small side, so that we can't offer all classes every semester. So if you don't follow the sequence, and because of your job or life, then it might be longer than a year. So, okay.
Yeah. And we have worked with students on their schedules, because a lot of them, they're mothers. They have full-time jobs, and they can't just do 8-hour days, consecutively. So I am very flexible in working with people to get those hours in. Can't let you do it from home, but if we could, maybe we'll get there one day. But yeah, we do work with the students so that they can get those hours in to fit their needs.
And with nursing, with the nursing degree, those clinicals are actually incorporated within the degree program. For anyone looking for internships, we definitely do try to work with people to figure out how we can help them get their hours. We do have a clinic out on 5th Street that's opened on the weekends, and we do have some practices that are have extended hours during the week, so we can always try to work with individuals on trying to complete their hours in that fashion.
Joanna, you have the last word.
I'll just circle around. Because I'm a graduate of the nursing program, I can actually start from CNA all the way through. So CNA, State Board of Nursing, requires 120 hours. PVCC's program is 142. Your clinicals are included within that program. For the other programs, registered medication aid is 72 hours. Clinicals are included in the program. EKG and phlebotomy have optional externships. The programs themselves are between 60 and 65 hours, roughly take about 8 weeks. The CCMA program, the full program, is 165 hours. It takes a full semester of full-time study plus a 120-hour externship after the completion of the program. The CCMA Advanced Pathway, where you take the individual credentials and then sit, the final portion of that is a 40-hour online module that kind of ties it all together while doing a 60-hour externship within a clinical site. And then you credential at the end of that. It takes about 2 months to complete. We give you enough time to complete those modules. So those programs can all be completed in about 6 months or less. The LPN program is a 3-semester program where the clinicals are included within the LPN program. The RN program is a 2-year commitment for the associate's degree, and the clinicals are included within the program. However, I will say that there are prerequisites to get into those programs, and so please remember that you're gonna have to tack on those prereqs. So you're looking at a semester to 2 semesters in advance work prior to entry into those programs. And then I'm going to actually hand off to ODU real quick because she follows after the associate's degree.
Welcome, everyone. This is awesome that you are in high school and are pursuing nursing. That is fabulous. Thanks to all of our panelists for being here. I am very honored to be here at on campus here at PVCC representing Old Dominion University's online program. We have a concurrent program with ODU, which is an online program. So once you receive your associate's degree, you can also then pursue going on to get your RN to BSN. But with our concurrent program, the courses that you take at PVCC directly transfer into ODU's program. So if you would like more information on that, I would be more than happy to connect you to our people who are in nursing. We start our program by making sure that you don't get lost in the online process. Old Dominion University's online program is accredited. All of the professors who teach the online classes also teach the on-campus classes. but I can get you in contact with a coach who can discuss more with you your interest in nursing. And then from there, you would be connected to an enrollment coordinator. The enrollment coordinator will review your transcripts to make sure that when you start the application process, you're right on course to make sure that you are ready for ODU's program. So I would be more than happy to bring literature over here to you today, and also to connect you then through just in a little inquiry form so that I can connect you to the right sources. So we're very grateful to be here on campus.
Thank you, Colette and Joanna and Gigi.
Yep, I have one quick thing for the PVCC students who are getting credit from their classroom teacher. Be sure you sign in here so that I can show your teacher that you were here. And thank you for the snacks. So
Right. And just so you all know, Joanna, Colette, and our panelists will be staying for a few minutes after we conclude, in case you want to talk to them. And actually, we are concluding right now. And so please just join me in thanking Susan Kabadi, Sarah Sotherden, and Camilla Washington for being here today to share their knowledge with you. And we'll see you next time.